Hi, this is Bill Patten, Interim CEO here at Rehoboth McKinley Hospital. I want to give you an update from the board meeting that was held yesterday, September 25th. This was a regular board meeting, and it started out with the normal call to order by Marianne Eustick, our board chairperson, reviewed the agenda, approved the minutes, and then had two very excellent presentations. First, Monica Torres, the Senior Director of our Patient Financial Services Department, presented an overview of her department, what they do, the people in it, to the board. This was very timely because following her presentation, we had a presentation from a partner of our new advisory services company, Ovation. The company's name is Amplify. They had done a deep dive into our revenue cycle, our accounts receivable, our bills, denial rates, that sort of thing, and they presented a very in-depth overview for the board. So it was a very good complement of Monica telling what her department does, and then Amplify showing some of the issues that we face. Following that, the board had reports from the Quality Committee, from the Finance Committee, from the Medical Executive Committee, the Credentials Committee, and at the end of that whole sequence, the board approved the credentials recommendations that came from the medical staff. The medical staff vets candidates, and then the board ultimately has the decision on granting privileges, their ability to actually practice medicine in our hospital. We then had a report from our Chief Human Resources Officer, Rebecca Martell. Rebecca shared with the board preliminary results from the recent employee pulse survey that we had done. A year ago, we had done an employee engagement survey. That had raised a number of issues, most of them around benefits. We touched base with the employees this year with what's called a pulse survey. We had more than 61% response, which is excellent. And on all three of the topics that last year we didn't score as well as we should have, we saw improvement. Rebecca will be providing additional information to the board at future meetings. Then Chris Dover, our interim CFO, did a summary of the Finance Committee meeting and also provided an update to the board on several longer-term projects that he's working on. So we're working to get caught up on our 990s. That's a form that we're required to give to the IRS. We recently had filed our fiscal year 21 990, and we're working now on the 22 and 23. We expect to have the 22 990 done within just a couple of months, and then the 23 will follow that. Also working on cost reports. Happy to report that in that area we actually are caught up. So we have filed all the necessary cost reports. And then the last category was audits, our financial audits. We're working on fiscal year 2022 as well as 2023. We expect that the 2022 audit will be completed by the end of this calendar year, and then we'll be able to move into the 2023 audit early into next year. And then the last thing is we're working to develop our fiscal year 25 budget. We have 8 months of actual data that we can use to build the budget. So we'll do 8 actual plus 4 projected, and over the next few months develop a board with involvement of the senior leadership team as well as the department management team, and have a budget ready to present to the board by the November board meeting. I gave the board an update on a couple of medical staff related topics. We have had an interview with a cardiologist. She had an interview following ours, so we're waiting to see where we rank as far as the interviews. This is part of our efforts to expand our cardiology program. I learned after the board meeting that our current cardiologist, Dr. Goulet, is working to add a cardiologist to his practice. We would welcome a proposal from him so that we could have the expanded coverage that we need without actually having to change groups. Also talked with the board about work that we're doing to expand the coverage we have at our Rapid Care Clinic down on Highway 66. We're looking to hire another nurse practitioner so that we can be open 5 days a week. The question was asked, why aren't we open on the weekends? And it's because utilization of the Rapid Care Clinic on the weekends is so low. When it was open, we would see 10 patients or less, and it's difficult to have a viable program with that low of a volume. Normally, we're seeing 40, 45 patients a day in the Rapid Care Clinic. Then I gave the board an update regarding the different buckets of money that we're receiving due to the efforts of the local politicians, the county, the city, working in partnership with our state elected officials, especially Senator Munoz. So I'll just quickly run through each of those. So in House Bill 2, there was a $15 million debt relief package that was directed to us. We have begun to see that money flow to us. We've received the first $2.8 million. We have already paid those dollars out to vendors with whom we have negotiated settlement agreements. As we submit additional invoices to the county, they will reimburse us, and we will continue in our efforts to retire all of the accumulated debt that we have. In my next report, I'll be able to give you a more detailed summary of where we actually stand. If you remember, when I started back in November, we had $33.5 million in debt. By the end of May, we had been able to reduce that to $22 million. We will have come down significantly from that, but a teaser, look for my next report. We'll have more numbers reflecting some of that $15 million that's flowing. On the $12 million in payroll support, there's a remainder of $4.2 million that will be flowing from the county to us in just the next week or so. We will be paying the county $2 million of that toward past due rent, and then we will be putting the rest toward other debt repayment activities. Senate Bill 161, that gives us $5.7 million over 2 years. We should actually be receiving $1 million a quarter beginning in October. We have completed all of the application process. We've submitted the cash plan document that was required by that bill. So we're looking forward to beginning to receive that money, and that will fund both day-to-day operations as well as be used partially for debt. And then the last one, the $480,000 that Representative Johnson got for us, that we will be using for capital equipment, medical equipment. We should be getting that money, but it is being prioritized a little bit lower than the bigger sums that I've already reviewed with you. I talked with the board about some of the efforts that we have underway regarding our daily cash numbers. That ties directly into the previous comments I made about revenue cycle. So we have efforts underway to make sure that we're actually getting credit for all of the work that we do, that we're accurately and timely capturing all of the charges that they're getting into the system, that required pre-authorizations are being done, and then the collection processes that are underway. We're looking at ways that we can improve both our current collection activities, but also we still have a lot of money in our old computer system. I think I've mentioned this in previous reports. We converted computer systems 2 years ago, June. There's still a lot of money sitting in the old computer. Most of it is reserved. That means we already have accounted for it on our balance sheet, but we need to actually process that money and either continue collection activities, or if it actually is uncollectible, then to write it off of our income statement. Also updated the board regarding the efforts to reconstitute our foundation, Western Health Foundation. The board voted to adopt a recommendation to appoint 3 people to restart that board. Those 3 people will be asked to do 2 things. One, to work with us to get a new bank account established for the foundation, and then 2, to work with us to create a new, at least 7-member foundation board. It's not our plan to begin fundraising right away, but we need to have a board in place before we can move forward. So I was pleased with the board's willingness to appoint those people. I've already spent a fair amount of time talking about revenue cycle or the income side of the equation. I emphasize to the board that we're also constantly looking at the expense side of the equation. So there are a number of expense reduction activities that we're going to be undertaking in the next few weeks. We want to make sure that the revenue is in balance with the expense. And so these are not one-time activities on either side. We will continually be looking at ways that we can optimize both our billing process and then also reduce our expense footprint. So I gave the board a summary of some of our plans in that area. I gave the board an update on a number of IT projects that we have underway. I think I mentioned in the last report that we have a new IT director, and he has hit the ground running. So he's working to help us fix that computer system that I talked about that we bought 2 years ago. It's called the Cerner Uplift Project. We're also evaluating our network servers and switches, and we're also looking at all of our desktop workstations and the desktop software. A lot of these are things that we will need to build into next year's capital budget, but we have to have the groundwork, the legwork done first. So we're very pleased with the work that the new IT director is doing. We're also looking at our printers, copiers, faxes, the whole fleet of equipment that we have in that area. We are including local options as far as who we're going to work with, but we want to make sure that we're again prepared for next year when our current lease expires so that we'll know how best to move forward. I talked with the board about our 340B certification program. 340B is a program under which for outpatients we can buy the needed medicines that our patients need at a reduced price. So updated the board on our efforts to get that program completely certified. I spent a fair amount of time talking about length of stay issues. So as a critical access hospital, our new designation as of a year ago, August, we have a requirement that on average, we not keep patients more than 4 days, 96 hours. As we have converted, it has been an interesting transition to make sure that we're meeting that threshold. And so we're working actively with the medical staff, with our case management team, with our ER team, house supervisors who are part of the admission process. But we want to make sure that we're in compliance with that 96-hour average. And I emphasize the word average because it doesn't mean that we're not allowed to keep a patient longer than 96 hours. It just means that most of our patients have to be less than 96. So an example, if we have a patient come into the emergency department that needs a surgery and we know that that patient will have to be in the hospital for 10 days following that surgery, we really shouldn't be providing care. We should be stabilizing, transferring them to a higher level of care. So wanted to make sure that the board understood what the issue was and the work that we have to address the issue. So we are working on what is called an annual review of services. This is another document that's required as part of our critical access status. What it's intended to do is to look at all of the services that we provide, evaluate their effectiveness, and then make a report to the board as far as any suggested changes that we need to make. Part of the idea is that as a smaller hospital, it's really important that we are meeting the needs of the community. So we're planning to have that report ready to present to the board at the October board meeting. And then we also talked with the board about the possibility of contracting with a company to provide grant writing services. There are a number of grants out there that would benefit Rehoboth McKinley, but we don't have the internal staff nor the expertise to be able to write first research and then write well-qualified grants. So we're looking at a company. This is an option that's available to us due to our contract with Ovation, working hard on that one. And then the board went into executive session in order to discuss a number of confidential issues. There were a number of personnel issues that were discussed, and they also discussed next steps as far as hiring a new CEO. And as we have a little bit more information in the next month, I'll be reporting on that. Hope you find this update helpful. As always, give me a call if I can provide additional information. Thank you.